Hello, I'm Viva Health's Chief Medical Officer, Dr. Tara Bryant. April is Alcohol Awareness Month. Alcohol is the most used substance by youth and adults in the United States and the third leading cause of preventable death in our country. About 95,000 Americans die from an alcohol-related cause each year. Alcohol Awareness Month is hosted by the National Council for Alcoholism and Drug Dependence. The purpose of this yearly campaign is to raise awareness and increase understanding of the causes and treatments of alcohol abuse and alcoholism. The terms alcohol abuse and alcoholism often are used interchangeably. Both are related to a problem with drinking and negative impacts on day-to-day life from alcohol consumption, but there are differences in these two terms. According to the American Psychological Association, alcohol abuse is a pattern of drinking that results in significant and repeated consequences. People who abuse alcohol may have a pattern of getting into trouble with the law, have difficulty staying in relationships, or have trouble keeping jobs because of their drinking. The key factor here is that they continue to drink despite these consequences. Many people who abuse alcohol drink every day, but that's not always the case. Binge drinking is just as concerning. Binge drinkers may only drink alcohol on the weekends as opposed to every day. But the problem here is the amount of alcohol being consumed at one time. When a man has 5 or more drinks, or a woman 4 or more drinks in less than 2 hours, this is considered binge drinking. No matter the frequency, if drinking habits have negatively affected your life or the life of a loved one, it's quite possibly alcohol abuse problem. Alcoholism is a chronic, long-term disease where the body becomes physically and psychologically dependent on alcohol. People with an alcohol addiction need to drink in order to function. Signs of alcoholism or alcohol dependence include tolerance, which relates to needing larger quantities of alcohol to get the same mind-altering effects. Withdrawal, which is when one feels physically sick if they don't have alcohol. Symptoms of withdrawal include headaches, nausea, tremors, and in severe cases, hallucinations or seizures. Compulsion, which is when you experience intense cravings to drink alcohol and find yourself unable to stop drinking even when you want to. Long-term alcoholism can result in life-threatening conditions such as heart disease, cancer, and cirrhosis of the liver. Alcoholism is influenced by a number of hereditary and environmental factors. For example, if you're genetically predisposed to addiction, you may be more likely to struggle with alcoholism. But regardless of your genetic makeup, excessive drinking can also lead to a cycle of alcohol abuse, and abuse can quickly progress to full-blown alcohol addiction. Being open about alcohol issues is an important part of reducing the stigma and judgment associated with this disease. If you or someone you love needs support, speak to your doctor or consider attending an Alcoholics Anonymous meeting, which are offered throughout the state. Visit aa.org and type in your zip code to find a meeting near you. And remember, help is available.